Well, hi, everybody. It's Angela Gill from the MHP Foundation. If you've been watching and listening, you know we're doing a little series of emails for our end-of-year fundraising campaign. Our staff put together some projects this year that we are using as projects for the end-of-the-year fundraising campaign. And it's been pretty neat. And these interviews are kind of a hope that we will inspire people to help us support these projects and kind of give them a little sneak peek about some of the things that go on at MHP that they may not be aware of. I'm here with Barbara McFarland. She is the aesthetics coordinator at MHP Plastic and Cosmetic Surgery. There's a lot more that goes on at that we call it the plastics office than you might think. It's not all about facelifts and that kind of stuff. There's a lot of other really good things that go on. And Barbara came up with a project that for education at the plastics office for skin cancer patients or patients that have a cancerous lesion. So why don't you tell us a little bit about that, Barbara?
Well, most people would be surprised about how many lesion patients Dr. Christea sees in a month. The very cool thing about Dr. Christea is, yes, he's a plastic surgeon and a general surgeon, but he's very open to helping out wherever we need him. And I've heard him say multiple times that he's here for the community, and one thing the community needs of him is to help with skin cancer type things. So he sees an immense amount of patients each month that are coming in with lesions that need checked out, and oftentimes they lead to skin cancer.
So you're going to do something with education and sunscreen, right?
Yes.
And that is, well, you go ahead.
That's fine. So what we're doing whenever a patient comes back in for a follow-up after they've been diagnosed with skin cancer, we are sending them home with some SPF. And then this will allow us to have an opportunity to go over the importance of skin care that includes SPF in it, and how to apply it and when to apply it, and to prevent hopefully future lesions from arising.
Yeah, it's pretty neat. So I know that in sunscreen or SPF, there's something called UVB and there's UVA. What are the difference between those two?
So the easiest way to remember UVA and UVB, they're two different types of UV rays, and UVA has to do with aging. So the A rays for aging, they cause us to age prematurely, and that is wrinkles a lot of times, or pigmentation. UVB, you can remember that for burns. Those are those really powerful burns that you really think of when you think of the sun when you're going out and you're getting these really bad burns. Those are caused by UVB rays.
That's interesting. I had no idea. Never knew that. So you would give people this SPF. Those come in all levels of protection. What do you recommend? What do you think is enough, but a good coverage?
Well, you really need, the most important thing is that you have an SPF that has protection from UVA and UVB, both. The American Academy of Dermatologists recommends SPF 30 or higher. And then they also want to make sure it's water resistant, because it doesn't do any good if it wipes away. And the last thing, I made a little note. Oh, actually, exactly what I said. The UVA, UVB, and water resistant, and a 30. Those are the three things the Academy recommends.
Good to know. That's really good to know. How much do you use?
So for your face, a nickel size is what you're looking for. So it doesn't need to be slathered on, but a nickel size to cover your whole face. And you want to, the benefit of having an SPF in a combination product such as a moisturizer is when you get in a skincare routine and you're putting on your moisturizer every single morning, you're already going out with the protection. And 80% of our UV exposure in a year is passive rays. So you're not going out and going swimming and sitting in the sun. It's the rays that you're getting when you're in the car. It's rays you're getting when you're walking out to the mailbox. If you have a window in your office and you're sitting at your desk, you're getting UV exposure all the time. So 80% of the year is this passive type rays. So if you have an SPF in the product that you automatically put on in the morning, you're getting that coverage.
Yeah. Where all do you put it? Your whole face? Do you get down here?
Oh, any area that's exposed to the sun.
Yeah. I think there are I believe, two kinds.
Yes.
A chemical barrier
and
one is a physical barrier. Is that right?
Yes. So if you think of a physical barrier, so these products have an ingredient that is a physical block. It's actually physically blocking the sun and deflecting the rays. And so when you put it on, usually it's a little creamier white. You can see as it goes on, and you can really see if you've missed a spot because it's, it's real white and creamy. And that's actually one of the benefits of a physical. You can see exactly where it is, but also then you're kind of white afterwards. So this is a physical block. The UVs come down, they're deflected by the block and away from the skin. There's two different types of physical blocks that you usually see, the titanium oxide and zinc oxide. Zinc is usually better for sensitive skin. So if you kind of have that skin that you gotta be careful with, you might look for a zinc oxide type of SPF. The chemical barrier has ingredients in it that actually, they absorb the UV rays and they transfer it to heat, and then your body releases the heat. So it kind of does a chemical reaction in the body. So just kind of two different types of SPFs, and some people are opposed to one or the other, but really the best type of sunblocks have both because you're kind of, you're blocked in two different ways, two types of protection.
Very, very interesting. Mm-hmm. I had no idea. Mm-hmm. So we get to send people home with a nice tube of sunscreen, a sample, and I just think that is really helpful. That if the doctor says here and hands it to you, I think that drives home the point.
Mm-hmm. Yes.
Yeah. Okay. Well, listen, folks, if you're ever in the market for a nice facial or a dermaplane or something like that, Barbara is your gal. and anytime you might have something on your skin. Oh, here's a good question. I forgot to ask you this. How do you know when you've got a spot that needs to be looked at?
So in general, if there's a spot that just looks different than anything else on your body, that's, it should send something off your brain. This isn't quite normal. Get that checked out. But other things to know, if a spot itches or if it bleeds and you haven't done anything to it, but you're like, oh gosh, I'm really itchy right here, and it's just always itches, always bleeds, that's a good sign that you need to get it checked out. If it has like a varying colors in it, Dr. Cristea calls it like a gunpowder type pattern to it, so kind of speckled, or if it looks like a map, which with really irregular borders, it's another one you should get checked out. But in general, just use your instinct. If you have something that, one that looks a lot darker than all the others, don't wait to get it checked out. Melanoma is nothing to take lightly. Dr. Cristea, I was asking him some questions, and one of the things that he told me that I didn't know is melanoma is one of the only cancers that can metastasize in a placenta. So a baby could be born with stage 4 melanoma out of the uterus, which is, I had no idea.
Never heard of that.
I had no idea. So
really
don't take it lightly.
Yeah, don't mess around with your skin. I think it'd be a lot better to go in and have him say, oh, that's nothing, but I'm glad you came in. And we'll probably check you everywhere if you want.
And a general rule of thumb is if you don't know whether you should call the plastics office or not, if it's something on the face, for sure. Dr. Cristea specializes in the face. If it's one spot on your arm or one spot on your leg, kind of like a one and done, I just want to get the spot checked, it's a good reason to call Dr. Cristea. If you want to do a full body check, then maybe you call the dermatologist and get a full body screen. And a lot of times the hospital will have, like in the summer, events where you can come in and you get a full body scan on a special day. So that's a good time to do that.
Yeah, it's a really good time. Yeah. Well, I hope that we've given some people some information they did not know today, and I appreciate your time. I hope that it inspires some of you to consider making a gift to help support these projects and all the good stuff that goes on at MHP. So thanks, Barbara.
Thank you.
Have a nice
afternoon.
Thanks.